Worker. Kelly, this is a really important topic. Why are we seeing this first and foremost as such a common pattern among athletes?
Sure. So good afternoon. I'm so happy that you all are covering this topic because athletes are extremely criticized in the media and from coaches and parents and their own self-criticism. And I think it is fantastic that people are coming forward and sharing their story and sharing some of their experience as well, because it gives others permission to say, me too. And so a lot of times there is a certain level of pressure that can feel all-consuming for athletes, whether it's high school, college, or professional athletes.
It's so wonderful when you do hear people talking about this, because it's important to just start the discussion, right? But we were talking before, and as someone who has spent most of her life dealing with her own mental health issues, sometimes when I look at the conversations around stigma and mental health, I think, oh, wait, is it a spectrum? Can we talk about it in this space of anxiety or a bit of depression therapy? That's good, but if we start talking about psychiatric help, people seem uncomfortable. How do you think the view of mental health is in society right now? Are we past the stigma, or are we still in a shades?
No way are we past the stigma, which is why it's so important for us to keep talking about it and educating. And it is a spectrum disorder. And so what we do see is there are levels of, as I call, anxiety or depression light, where somebody might be able to be higher functioning, but certainly it crosses over into this gray area, and then even more severe psychiatric issues if people are engaging in self-harm or having suicidal thoughts or having a hard time functioning. And so sometimes we don't see those things. We look at those as red flags for somebody who might be struggling. But a lot of people internalize and are perfectionistic in the way that they present. And so we never know what's going on in somebody's head.
But speaking of that, sort of what are some of those other signs? Because, you know, as we sort of talk about this space, and we love to hear and empower these types of stories, how do we look for the signs? How do we differentiate what is a clinical trauma versus what is difficulty or discomfort?
So difficulty and discomfort is a normal feeling. We have a range of feelings. And so if somebody is having a difficult day, take a pause, take some time to restart and refresh. If you're noticing that somebody on your team, perhaps on your sport, is withdrawing or isolating or not finding that they have a shift in their mood, that may be an opportunity to have a conversation and just check in with them. How are things going? Remove yourself from the sport and do something that is less of a pressure cooker. Go out for coffee with somebody, go for a walk. Those are opportunities for people to have conversations outside of the pressure that they might be experiencing on a daily basis.
Do you think it can be harder for people who are in high-demand sports and places like Ricky Rubio to take a step back because of the demands they put on themselves just in achieving those sports-related goals?
Absolutely, and I think there's shame and embarrassment and how are people going to view me? And what I really want to work towards with working with athletes and younger people is a preventative measure. So let's not wait until we're in crisis mode, but let's keep a pulse on mental health. Mental health is health, and so it's a holistic approach.
I know we have to wrap here, but I have to say, I think one of the most important questions to ask is grief can be scary for a lot of people when they see other people go through it. How can we help? What should we ask? How do we support people if they're struggling?
People are afraid to have hard conversations. And so being direct and using an approach that makes somebody feel comfortable in a non-judgmental way is really the best way we can support somebody.
All right, psychotherapist Kelly Kiley, thank you so much for being here. This was a wonderful conversation.
Wonderful.
We appreciate it.
All right, you are watching NBC News Daily.